This is Pat.
This
Can I
call
help
is
you?
being recorded.
Hi, Pat.
Can I help you?
Yes, Pat. My name is Nick. Yeah, my name is Nick Coram. How are you?
I'm pretty good. How are you, sir?
I'm good. Hey, I saw that we were messaging. I figured might as well just make it a call.
Okay. How can I help you?
Sure. So the whole reason I believe you had to message me was just simply because it does seem a little bit odd. The fact that she has 2 records that day, even though no matter what happens, I receive emails anytime records are printed out.
Mm-hmm.
So for the fact that there's 2 that day, but I'm sorry, I only received 1 notification, but there are 2 printed out that day.
You only received one MyChart message?
Yes,
So,
like one email notification.
Oh, well, that part, I'd have to look into Epic on that because I don't know how that works.
Absolutely. I think you should. But then also, additionally, like the real problem in all of this is the fact, like, I know for a fact when I left that office that day, more defeated than ever because Cheryl Armstrong had literally said, "You're a yoga instructor, right?" I said, "Yes." She's like, "Well, you understand mind over matter?" I said, "Yes." She's like, "Well, then this is all in your mind." So, again, she was alluding to the point that she did not need to prescribe me anything, hence why I walked away with that record. And that's why I'm trying to make it a point to say, like, until I did actually receive the proper medication from Abigail Cook on February 19th, she's the one who prescribed me the right stuff, and then all of a sudden the record changed that say that Cheryl prescribed it.
Who's Abigail Cook?
Abigail Cook did it, and I've taken images of all this. So I'm sure if you looked at my prescription record, you'll see that too.
No, wait. Sorry, I don't know these doctors. Who's Abigail Cook?
I guess I don't want to go too into that then, because then there's a whole side. No.
So first of all, the After Visit Summary is printed at time of discharge. A lot of times, I couldn't tell you how often, providers put a flag out outside the door that tells the medical assistants the patient's ready to go, okay? Sometimes they don't have the After Visit Summary printed, so the medical assistant prints it. Sometimes they print it, and the medical assistant goes and grabs it off the printer and takes it in to discharge the patient. And then occasionally the docs finish up their notes and expand on it. Now that was within a 2-minute time frame. So I'm pretty sure when they wrote that they did a prescription at that point in time that I believe was sent to King Soopers.
Mm-hmm. No? All right, so then let me ask you this, because obviously never received that prescription, hence why I had to get it from Abigail. Let's talk about how soon do they often upload the records to stuff? Like how soon? Like after a visit.
How soon does it get uploaded to MyChart?
Yeah, like how soon would I expect to receive like an after visit summary, or what's a reasonable time frame?
I will have to ask our help desk because I really have no idea.
I mean, at least to my knowledge, like it seems like it's pretty close within the day. Like it takes like minutes afterwards.
Mm-hmm.
Is that accurate?
I don't know. I honestly don't know, but the only time she can't change the date and time of this, so they were printed basically 2 minutes apart.
Sure. Well, could somebody print something on a different day and then upload it as that day's report?
No, it would have a new date. You would have if she did it today, it would not have that date's report.
So like let's say somebody did something one day and then they printed it like a week later and then they put it back onto that day.
I think they'd have to do that as an addendum and post date it. I don't think they can change that. And they can't. Can you Can you see when you got your AVSs? Can you tell?
Yes,
In my chart?
yes, I get emails down to the minute until when they're done.
Okay,
when they're printed.
Do you know when you got those two?
I only received an email regarding. I've only received one email, but in my document center, I have two different visits for that day, and those visits happen 2 minutes apart, like you said. But I can guarantee you, I only walked home with one thing because Cheryl said that she said there was nothing wrong with me. She said that it wasn't anything, and I have record of all of this. So because I have record of it.
On the charting, it says to start the adapalene.
Yeah, that's the one that's added 2 minutes later. The one
correct.
that I did not receive.
But you should have left with the prescription, or they sent it electronically to your.
She was convinced of not giving me a prescription. She said she was not giving me anything, and this is all a part of my complaint that I've already made with other organizations. They're aware of that too. And then aside from that, so you're telling me that somebody couldn't print off something 2 days later and then upload it as that day, right? It would have to have the same date.
Right. When you document, it goes to the date and time you document. They can't change that. They can go in, let's say I did your chart, and a week later your lab work comes back, okay? And I want to add that to your chart. So then I have to create an addendum, and it's called an addendum, and it has the new date and time. I can't in June put in the May 27th date.
So let me ask you this. So like if I had a visit at 8:30 in the morning one day, and then the record was actually printed off 2 days later at 10 a.m. and then uploaded. And then when I go check my after visit summary in my chart, it says the information might have changed since your visit.
Oh, yeah, I think I have my chart. I think I've had it say things changed, and sometimes I look and I don't even see anything, and I'm like, I don't know what changed.
But the dates are obviously different because it says the date of my appointment was one time and date, and then the time is printed as 2 days later.
I'm gonna go to my chart here.
Yeah. And just so you know, I'm recording this call.
Yes, I know you're recording me. Okay, so that's wrong. Let's see. May 27th, right?
Well, actually, no, that's not even the appointment that I'm talking about. But I want to verify with you, like, that's...
What appointment are you talking about?
Well, I mean, I want to verify with you that that's obviously not something that's ethical.
What's that?
That for somebody to print off a medical record 2 days later and then change it because especially because I can see what was there originally and then I can see what was changed.
Right. The only thing that was changed was the drug was added, and that was 2 minutes later.
Okay, first off, like, one, that's a big change, and two, not even what I'm talking about. I'm talking about a whole different visit altogether because, again, this is where things really start getting weird. But, like, obviously, if you're not very much in the know of things right now, you've already kind of told me all the things that, I know is wrong. You know it's wrong, too. But, like, I've already described a situation to you. And when I've described the same situation to other doctors outside of Denver Health, they're like, that's really, really weird.
Well, If they make a change in the note a week later, it would reflect the date and time of the change. They can't put the date.
Yeah, I know. That's because, and that's the thing is, like, I received an after visit summary on a day that I didn't have a visit. That's how I know everything was weird. And I received a notification about it.
You mean you got the after visit summary later? Is that what you're trying to say?
Yes, I got an after visit summary for 2 days later. So I received 2 after visit summaries for the same visit. And now it's been changed because it was like there was one that was put up, and then there was another after visit summary done, and then changed. And then same with the medication. Like, and for whatever reason, I know actually quite a bit about database systems. I know about time record keeping and stuff like that. So I know that's why you'd have to duplicate a record to make a change like this so seamlessly. That's the only way it works, because you have to add something, you have to take something away.
So, okay, so I'm a little confused with what the issue is, because yes, there were 2 AVSs done that day, 2 minutes apart. One had the drug added, one did not. I don't know what one you walked out with, because I don't know if it was physically in your hand.
And I can tell you, I walked out with the one without the drugs on it, because she was very upset with me. So I know for a fact, but I also know that Abigail Cook is the one who prescribed me that medication. And then I saw that it got changed, that Cheryl did it.
I'm looking at your prescriptions here.
And I do have screenshots of it.
So it looks like, hang on, I'm looking at your stuff. Hang on a second. I have someone at my. Are you there?
Yeah, I'm here, and I understand. You have to do your thing.
Yeah, I'm going to put you on hold for a second because I have someone at my door.
Sure thing.
So just a second.
303-436-7000. For the latest visitor guidelines at Denver Health, visit denverhealth.org/visitors. Current Denver Health patients can go to denverhealth.org/mychart to schedule or change an appointment. No matter who you are, we're here for you. Denver Health is an integrated system of healthcare, including primary and specialty care services, a nationally recognized Level 1 trauma center, and the Denver Health paramedics. The main campus, located at 777 Bannock Street, offers free parking for patients and visitors. Thank you for calling Denver Health. If this is an emergency, please hang up and dial 911. For urgent medical questions, call our 24/7 nurse line at 303-739-1211. Making an appointment for a COVID-19 vaccine is easy. For Denver Health patients and non-patients, visit denverhealth.org/COVID vaccine or call 303-436-7000. For the latest visitor guidelines at Denver Health, visit denverhealth.org/visitors. Current Denver Health patients can go to denverhealth.org/mychart to schedule or change an appointment. No matter who you are, we're here for you. Denver Health is an integrated system of healthcare, including primary and specialty care services, a nationally recognized Level 1 trauma center, and the Denver Health paramedics. The main campus, located at 777 Bannock Street, offers free parking for patients and visitors. Thank you for calling Denver Health. If this is an emergency, please hang up and dial 911. For urgent medical questions, call our 24/7 nurse line at 303-739-1211. Making an appointment for a COVID-19 vaccine is easy. For Denver Health patients and non-patients, visit denverhealth.org/COVID vaccine or call 303-436-7000. For the latest visitor guidelines at Denver Health, visit denverhealth.org/visitors. Current Denver Health patients can go to denverhealth.org/mychart to schedule or change an appointment. No matter who you are, we're here for you. Denver Health is an integrated system of healthcare, including primary and specialty care services, a nationally recognized Level 1 trauma center, and the Denver Health paramedics. The main campus, located at 777 Bannock Street, offers free parking for patients and visitors. Thank you for calling Denver Health. If this is an emergency, please hang up and dial 911. For urgent medical questions, call our 24/7 nurse line at 303-739-1211. Making an appointment for a COVID-19 vaccine is easy. For Denver Health patients and non-patients, visit denverhealth.org/COVID vaccine or call 303-436-7000. For the latest visitor guidelines at Denver Health, visit denverhealth.org/visitors. Current Denver Health patients can go to denverhealth.org/mychart to schedule.
Nicholas?
Yes.
Oh, sorry. Okay, so I'm looking at your medications. So Sarah Shangraw was the derm resident that saw you with Cheryl Armstrong. On 5/27, they sent a prescription for that medication to King Soopers in Edgewater on Sheridan Boulevard.
So, and I'm telling you, at 10:19, when I left, she was convinced that she was not going to be prescribing me anything. So I can check with King Soopers. I can see if it was actually sent to them. But I can also tell you right now, I walked away with no prescription. And then I guess, let me ask you this. What does it mean when somebody says, I'm not interested in burdening the insurance system with this? Can you maybe explain that to me?
Now say that again.
What does it mean when somebody says, I'm not interested in burdening the insurance system with this?
I'm not sure what that is in relation to.
Well, that's what Cheryl had said to me.
In response to what?
When I asked her about getting a different, I heard somebody start recording this too, so you should probably just say that, in response to asking for additional medication. She said, I'm not interested in burdening the insurance system with this.
Well, I don't know what she would have meant. I can't speak for someone else. The only thing I can tell you that she did e-prescribe. The resident was the ordering doctor, and she was the authorizing provider. And it was King Soopers in Edgewater, 1725 Sheridan at 17th Avenue, and it was written on May 27th. If I'm reading it right, I think it had 2 refills, and then Abigail Cook, who is a PA in urgent care, discontinued that order on February 19th, and the reason was to do a reorder. I don't know how that works.
Exactly.
So she put a new order in.
Potentially, but all I know for sure is I was never actually prescribed that, because that is the only thing that's ever made a difference, and that's what I would have taken had I known that. But at the time, Cheryl was convinced that it was something different, and she was convinced that she was not willing to do it. And then all of a sudden, when I did receive it, and even during my recording with Samantha Lewis, I said, this has been helping. She overlooked it totally and just said, no, something else. And so, that's recorded.
Does King Soopers ever notify people when you have a prescription to pick up, or not really?
Because I think that's their responsibility, because I think the responsibility does fall into the lap of the person who told me she wasn't giving me medication. I have no idea. I left so sad, because I was like, she was like, I'm not helping you, and it's because I wasn't vaccinated.
Well, I don't know anything about your vaccine status, and I don't know about vaccine status and
She
how
asked,
any
so she
provider
asked
would
about
respond.
she asked about my vaccine status. She asked why I didn't want to get it done, and then from there on out, it just everything turned. It was like, oh well, basically, again, that's where in my head I was like, maybe that's what she meant. She's not interested in burdening the insurance system because she assumes I'm going to die. And I can tell you this, as like terrible as this gotten over the last 2 years, I definitely thought about suicide many times. So this is why I'm trying to just like figure it out. I know that this is wrong. I think you do too.
The only thing that I can tell you is what I know from what's documented. I mean, I can talk to Dr. Armstrong whether she remembers a patient visit from May 27th. I can't answer that question.
That's fine.
And
that's
I
fine.
Tell you that what's documented there was that they were adding the medication and that they did send the prescription to King Soopers.
Okay,
Whether King
that's fine.
notified patients or not, I have no idea.
Sure, and I mean, I can tell you that they did not notify me that they were prescribing medication. I know for a fact. I received the report that was printed on 10/19. That's the one I received.
On 10/19?
Yes. There's an additional report that was printed off at 10/19. You're saying it's 2 minutes apart? I received
time-wise.
that
I'm thinking October 19th, sorry.
Oh, yeah, I'm sorry. On 5/27 at 10/19, that's the one I got and left with that says stop taking medication and nothing else.
Okay.
And the first time I've even heard of Adapalene gel was when Abigail Cook prescribed it on February 19th of this year. That's the first time.
So when did you, but you said you got the other AVS, the one that was printed, because you had two in your file.
Yes, I got the one at 10/19.
And the one at 10/21.
Yep. But I've only received one email notification that day. So my best guess is that chances are somebody's probably pretty good with Photoshop.
Oh, believe me, we have better things to do than Photoshop
I know.
around here.
Well, I mean, this might be pretty bad though, to change a record like that. So
they cannot go in and change this stuff in Epic. I can tell you that.
Well, then I can tell you that anytime that I've received a record, I've always received an email of me getting one sent. And then all of a sudden, this is literally the only one that has a print record that doesn't have 2 emails notifications. This is the only visit. Everything else, which is again why I'm asking about the other day's one, because I know how that would work. I know how that's done. So that's why I'm like, oh, well, obviously, now that you, especially since you're like, well, that would be really weird if they were able to print the record on one day and it shows the same day, right?
Say that again? You're losing me, sorry. So
yeah, sure, I'm sorry.
So basically, you left with an AVS. I don't know, of course, for a fact which one you left with. You're saying you're left with the one that did not say that adapalene.
Correct.
The resident probably corrected it, and the MA probably, I don't know. The medical assistant might have discharged you before they corrected it. I don't know what their conversation with you was. I only know what the notes state. The notes say that they put you on adapalene. And if they did the notes that day, they cannot change the date they did the notes. It tells you the date they did the notes. So I don't know.
Is that same for the summary? Is the summary the same system?
What's that?
Is the summary the same system? Like, could somebody upload a summary later?
No.
No, again, I'm asking, is it possible that the summary can be printed on one day, but then show the visit for the other day, 2 days prior?
They do the after visit summary at the time of discharge.
Okay.
And
usually.
Right, so they do it the same day. No, they always do the AVS the same day. If they make changes, it's usually the same day because they were like, oh, we were going to give you a flu shot before you left, and now I changed it. And then usually tell the medical assistant, if they don't know if the medical assistant already checked you out, they tell them, hey, I added a flu shot or whatever. But
interesting is that now that I'm like really inspecting this and looking into it, it's interesting how like my medication list could have a different time set than when it's printed, especially seeing how it was done days differently. Isn't that interesting?
You mean your medication list?
Yeah, like it says your medication list as of the day and time.
No, the medication list varies by clinic. So let's say you had a medication list with me in Derm, and maybe I reviewed your 20 meds you're on. Maybe I didn't. And then go to your primary care doc, and they review it. So that the date and time could change when you go visit a different provider.
So I'm looking at my other ones, and it seems like this one is very consistent in the fact that it says the time it's printed. Let's see if it's even consistent with the time and date of my appointment. All right, so the appointment, I can see how that could be different. How like you might see a different time of print versus what the actual appointment time is. But with this one, I'm seeing that the date and the time are consistent with my medication list. It's the exact same time and date. And this is again the only one. This only other visit. Not, and I don't even know. Let's look at that one then. Let's check 1 second.
So you're looking at your medication list and your AVS. Is that what you're saying?
Yeah.
So, well, the medication list prints out with the AVS. Is that what you're talking about?
Yeah, I guess.
Because usually the AVS is like 7 pages long.
Yeah, that
and
makes
the
sense.
meds on the back of it.
So the fact that it wouldn't even be possible for somebody to have like a different time for their medication list versus like the time that it was printed off.
Okay, you're losing me here. So basically, when they print the AVS, at the bottom of the AVS is long. If they give you all the pages, there's usually like 7 pages. And
7 pages.
Future appointments, and it shows you a list of your medications.
So I guess to be more specific, at the bottom of every AVS, it says my name, my medical records number, printed, the date and the time that it's printed. Right?
Okay. Yeah.
And then, so then it wouldn't be possible for somebody to have exactly what I described to you as far as the date and time, but then have a different time for their medication, right?
Well, I'm looking at your. I'm going to look at your after visit summary.
Yeah.
Let me go back to it.
And I appreciate you taking the time to look into this too, because like I do know you're busy.
So I think the first thing at the top I think is your appointment time, May 27th at 9:30 in the morning, right? And then page 1 is your name printed on 5/27 at 10:19.
Yes.
And then it says your medication list as of May 27th at 10:19.
Yes.
When they printed it the first time, shows your medication list.
Yeah.
Now, if I go to your other AVS, so I'm going to go to your other AVS. Oops, hang on. And that one was printed at 10:21. And when I go down to your medication list, it's the same thing.
Yeah.
So the medication list matches the time and date that was printed.
So the medication list always matches the time and date it's printed, right?
Correct. Now, your medication list may or may not be correct if a provider, like if you're on a high blood pressure medicine and no one asked you about it, and maybe you quit taking it, then it might be on here and you stop taking it, but it didn't get taken off your list.
So what do you think would be the case then? Like, why would there be a reason that I might receive a printed document that states the time it's been printed versus the time the medication list, and date and time.
No, they match.
Possible. They can't. It's not
no,
possible.
They match.
Well,
right,
I know, but I'm saying, well, like, what would you say would be the case if something like that happened?
Well, are you saying yours did that? No.
Well, I'm asking you. Like, I'm just
I don't
asking.
I don't think it can do that.
But if somebody did do that, like, what would be the case?
They can't do that.
I know, but if
I don't think
you
can do that.
I know.
I don't think they can change it.
Okay,
they
but I'm
can't
asking
change it.
So what if somebody did change it? Like, what would be the case? Like, I'm asking you.
Sir, Nicholas.
Yes.
They cannot change it. They cannot change it.
I have proof of it. I have a picture of it. I'm looking at it right now. I haven't told you what date it happened.
Okay,
then
scan and email it to me.
No, I'm asking it because I've already sent all my documents to the medical board. They know.
Okay.
So I'm not sending any. I don't necessarily have to send anything to you, but I have images of it. So I'm asking you, what would be the case of this? Why would somebody do that?
They would only be the medication list if it's part of the AVS. Now, if you're going somewhere else in your chart for your med list, that's a different story. But the medication list printed out with your AVS has to match the date and time of the AVS.
Exactly. And then on top of it, the date and time of the AVS would normally be probably within hours of the appointment, not necessarily like days.
Right. I mean, we do have providers that are late at doing their charting, but if they make an adjustment, then they probably would have told you. Right.
But I, again, didn't receive any. And I'm not. And the thing is, at this point, that's what's kind of crazy and scary to me in all this is because, I'm not even talking about Cheryl's appointment. You've just confirmed so much stuff for me.
So I'm not sure what it is you're talking about.
I know.
So
I know.
So here's what you can put in your recording that you were seeing on May 27th. You had an AVS printed at 10:19. The AVS did not have the adapalene on it. The provider printed another AVS at 10:21 that had the adapalene on it. They sent the prescription to King Supers for you to get filled. They documented in their record that they gave you the medication that you requested. I cannot tell you which AVS you left with because I do not know.
Okay. But then I think it's safe to say...
The medical record is the updated one. The one that went to you in my chart apparently was both copies of 1019 and 1020.
And again, I'm sorry if I came off as rude. And I keep apologizing to people because I'm not trying to do that. And please accept. I'm sorry. I have, I guess, just last question.
And I can't answer any questions related to any other appointments you have at Denver Health.
That's fine. This is a very generic. This is a very generic question, and I think it's just because we've kind of went over it already. There isn't really a way to have a AVS with a different print time and date, as well as having a different medication list with a different time and date. Right?
If your medication list was changed...
Yeah, if it was changed.
If the medication list was changed, whatever prints out... Okay, so let's say I see you, and I print out your medication list at noon.
Uh-huh.
And then I take medicines off it or add medicines, right?
Uh-huh.
And I put that on your AVS. Whenever I print it, the medication list will match the rest of my AVS.
And that's what thank you. Thank you. That's exactly
but she
right.
did not. But this was done 2 minutes apart. It was not done days apart. And a prescription was sent to King Supers.
I'm not talking about this, is it though?
And then I don't know how quickly the AVS gets sent to you through Epic. Since you got 2 AVSs, I'm guessing that it goes through fairly quickly, but I would have to ask the computer people because
Sure.
I don't want to be quoted because I don't know the answer on that.
No
But
worries.
if you got 2 AVSs, then I am guessing that it comes to you fairly quickly.
No worries. And I mean, I do have a background in database management and automation, so I'm familiar with how it works out, just because like that's kind of the part side to the security system aspect of all of it, to make sure that like when you guys make a record, I do get a notification saying that it's been made. And that's why I can also say that I know that fake records have been made on days that I didn't even have visits, and then added, and then changed. And then the record shows that it's been printed at one day and time, but then it shows my medication list is a different day and time, and it shows that my visit is an entirely different day.
You're not talking about your dermatology visit. You're talking about something else now, I'm assuming.
Yes.
Yeah, so I can't address that. It would have to be a review of that individual date and time. Providers sometimes finish charts, not the same day.
It did happen in your, what's up, say again?
I said sometimes a provider might do their chart the next day when they're completing, because sometimes they're waiting for lab results.
Mm-hmm.
Or
but the medication list. But the medication list would be the same. Huh?
If they do a biopsy, they might update where they put the results of the biopsy in.
Sure.
But that would be an addendum to their note.
I don't see any addendums. I mean, I'm sure that I probably would have had to have received a notification of having an addendum anyway. Either way, so.
Are you looking at my chart through? Are you looking at my chart through your phone or through a computer?
I'm looking at the document center. So.
Yeah, but is it, because I know that in my chart I can see more stuff if I'm on a computer than if I'm on my phone.
Yeah.
That's what I was asking.
Sure, for sure. And yeah, that's kind of the thing, is like I know where to go to find like where the original ones are made and then uploaded. And that's why I can tell you what I'm telling you. All right.
So do you regularly look at your AVSs when they come to you in my chart?
Absolutely. I always check that. And the thing is that whenever I get an email saying that I received a visit when I didn't have a visit, then I naturally know something's weird.
So how did you not see the second AVS from dermatology?
Say again?
Why is it that if you diligently look at your AVSs in my chart, why is it that you did not see the second AVS from dermatology on May 27th, 2021?
Do you think that's an appropriate question to ask me as a person who suffered through dealing with somebody like this? Do you think that's okay?
Well, I think it's an appropriate question.
Quite frankly, I don't think that's your place. I don't think that's your place at all. And I am done with this conversation. You have more than answered my question. I appreciate all your time. I hope you have a wonderful day.
Have a good day. Bye.